We're here to help you stay well this winter. Some important information from the NHS to help you stay well this winter. Stay well this winter. Stay well this winter. Winter conditions can be seriously bad for our health, especially for people aged 65 or older and people with long-term conditions such as COPD, bronchitis, emphysema, asthma, diabetes, or heart or kidney disease. Being cold can raise the risk of increased blood pressure, heart attacks, and strokes. The cold and damp weather, ice, snow, and high winds can all aggravate any existing health problems and make us more vulnerable to respiratory winter illnesses. But there are lots of things you can do to stay well this winter. Feeling unwell? Don't wait. Get advice from your nearest pharmacist. At the first sign of a winter illness, even if it's just a cough or a cold, get advice from your pharmacist before it gets more serious. Act quickly. The sooner you get advice from a pharmacist, the better. Pharmacists are fully qualified to advise you on the best course of action. This can be the best and quickest way to help you recover and get back to normal. If you can't get to a pharmacist yourself, ask someone to go for you or call your local pharmacy. Make sure you get your flu jab. The flu virus strikes in winter and it can be far more serious than you think. Flu can lead to serious complications such as bronchitis and pneumonia, and it can be deadly. That's why the flu jab is free if you're aged 65 or over, or if you have a long-term health condition. If you have children or grandchildren aged 2, 3 or 4, or in school years 1, 2 and 3, they are eligible for a free flu vaccination. And if you are the main carer of an older or disabled person, you may also be eligible for the free flu jab. Just speak to your GP or pharmacist. You can also find more information at www.nhs.uk/getflujab. Also, don't forget that if you're aged 65 or over, you are eligible for the pneumococcal vaccine. Which will help protect you from pneumococcal diseases, such as pneumonia. Ask your GP. Keep warm. It is important to keep warm in winter, both inside and outdoors. Keeping warm over the winter months can help to prevent colds, flu, and more serious health problems such as heart attacks, strokes, pneumonia, and depression. Here are some things you can do to keep warm. Heat your home to at least 18 degrees Celsius, 65 degrees Fahrenheit. You might prefer your main living room to be slightly warmer. Keep your bedroom window closed on winter nights. Breathing cold air can be bad for your health, as it increases the risk of chest infections. Keep active when you're indoors. Try not to sit still for more than an hour or so. Wear several layers of light clothes. Several layers trap warm air better than one bulky layer. Make sure you're receiving all the help you're entitled to. Learn how to make your home more energy efficient. Improve your heating. And keep up with your energy bills at www.gov.uk/PHE/keep-warm. And check your heating and cooking appliances are safe. Contact a gas-safe registered engineer to make sure they're operating properly. Visit www.gassaferegister.co.uk. Check your medicine cabinet. Ask your pharmacist what medicines should be in your cabinet. To help get you and your family through the winter season. Many over-the-counter medicines, including paracetamol and ibuprofen, are available to relieve symptoms of common winter ailments such as colds, sore throat, cough, sinusitis, or painful middle ear infection, earache. So talk to your pharmacist for advice on getting the relief you need. To manage winter illness symptoms at home, rest, drink plenty of fluids, have at least one hot meal a day to keep your energy levels up, use over-the-counter medications to help give relief. Prescriptions. Make sure you get your prescription medicines before your pharmacy or GP practice closes for Christmas. You can also order your repeat prescriptions online. To sign up to GP online services, ask at your practice, or to find out more, visit nhs.uk/GP online services. And if you've been prescribed antibiotics or any other medication, make sure you take them as directed. Look out for other people. Remember that other people, such as older neighbours, friends and family members, may need a bit of extra help over the winter. There's a lot you can do to help people who are more frail than you. Icy pavements and roads can be very slippery. And cold weather can stop people from getting out and about. Keep in touch with your friends, neighbours and family and ask if they need any practical help or if they're feeling under the weather. Make sure they're stocked up with enough food supplies for a few days in case they can't go out. If they do need to go out in the cold, encourage them to wear shoes with a good grip and a scarf around the mouth to protect them from the cold air and to reduce their risk of chest infections. And make sure they get any prescription medicines before the Christmas holidays start and if bad weather is forecast. If they need help over the holiday period when the GP practice or pharmacy is closed, call NHS 111 and speak to a call advisor who will be able to direct you to a local service that is open. You can also find information at www.nhs.uk. 5 things we recommend you do. Make sure you get your flu jab. Keep your home at 18 degrees Celsius or 65 degrees Fahrenheit or higher if you can. Take advantage of financial schemes and discounts to help you pay for heating. Visit your local pharmacist as soon as you start to feel unwell with the symptoms of a respiratory winter illness. Look out for other people who may need a bit of extra help over the winter. Also, make a note of the contact details of your local pharmacy. And make a note of things you need to remember to do for winter. Where to go for the right medical care. Call 999 for life-threatening emergencies. You can text the emergency services on 999, but you need to register your phone in advance. To find out more, go to emergencysms.org.uk. Call 111 if you need medical help fast but it's not a 999 emergency. Call NHS 111 for clinical advice, assessment and for direction to the most appropriate services for treatment. NHS 111 also offers a video relay service via a BSL interpreter at www.interpreternow.co.uk/NHS 111. The BSL interpreter will call NHS 111 on your behalf, and you're then able to have a real-time conversation with an NHS 111 advisor via the interpreter. The 111 advisor will assess you and direct you to the best placed service in your area. The NHS BSL video relay service is open from 8 a.m. to midnight every day. To use the relay service, you will need a webcam, a modern computer, and a good broadband connection. For more details, go to the Interpreter Now website. For less urgent health needs, contact your GP or local pharmacist. You can also access NHS advice at www.nhs.uk. For more information and advice, visit www.nhs.uk/staywell. This publication is available in this and other alternative formats from the Campaign Resources Centre or by emailing Public Health England. campaignresources.phe.gov.uk, inquiries at phe.gov.uk. www.nhs.uk/staywell. Stay well this winter. Produced by Williams Lee, BDS Communications and Flashing Lights Media for Public Health England. Crown Copyright 2016. Product code 3220113 BSL.